male Foley insertion video. So the first thing I'm going to do is check to make sure that there is an order for this, and then I'm going to go over the patient's care plan. I'm going to go ahead and identify the patient. Can you verify your name and date of birth for me? Okay, I'm also going to discuss with my patient any allergies, including iodine. My patient did inform me that he does have an iodine allergy, so when we get to the procedure, we're going to be using the hydrogen peroxide. Before I came in, I would have put on any PPE and performed hand hygiene. I'm going to put the bed to a working height. And we do have adequate lighting. If we didn't, we might use some artificial lighting, but we should be good. I'm going to lower this bed rail. And I am going to inform my patient, we are going to be exposing you to clean your perineal area before the procedure. So I'm going to get my gloves on. I am going to be uncovering you. And then I am going to put a bath blanket over him. And I am going to assist him to spread his legs out a little bit. We're going to put a waterproof tux pad underneath the area. And we do have warm soap and water in here, so we are going to go ahead and clean his genital area. So we are going to retract the foreskin, clean around and then down. I'm going to use a different part. Alrighty. So we're going to dry him off. We're going to get rid of this. Get off these gloves. Away. Alright, and we are going to get ready to place the Foley catheter. So I'm going to keep this for my garbage. We're going to grab the sterile glove package out. Alright, and then so now we have our sterile gloves on. We're going to go ahead and grab this. Fuck that, and we're going to be ensure not to touch him so we don't contaminate our gloves. Alright, and then now we are going to, I'm not going to be using this. I'm going to put this over here. So I'm going to first take this off. I wouldn't have let that touch that in other circumstances. We're going to get rid of the iodine because we are going to be using the hydrogen peroxide. So first we're going to open the hydrogen peroxide and soak the cotton balls with that. We're going to open the lubricating jelly, squirt that there, get rid of that. We're going to get the cap off of this. We're going to attach it to the Foley. And then we are going to untangle this a little bit. And we're going to lubricate the tip 1 to 2 inches. And we'll set that there. So now I'm going to retract the foreskin. And I'm going to grab a cotton ball. And we're going to clean in a circular motion all around. All right, so now that we have it cleaned, we're gonna grab this And we're gonna let Mr. Jones know that we are going to be inserting it and for him to bear down. So we're going to insert this until we have urine return, which we do, and then we're going to advance it another 2 to 3 inches or until the Y bifurcation. So we're going to keep inserting that. All right, then with this hand, I'm going to go ahead and pinch that there. I'm going to inflate the balloon. All right, so now that we're gonna give it a little tug so it is in place. And then we're gonna get rid of all of this. And then we're gonna go ahead and grab the leg strap. And then we are going to hook this right below the Y bifurcation and secure that. And then we're going to take this, hook it to a non-movable part of the bed below the bladder. So we're gonna have it hanging there. Then we're gonna cover the patient back up, get them into a comfortable position, and then we're gonna, for the removal, we're gonna come back in, identify the patient, make PPE, perform hand hygiene, and then we are going to let the patient know we are going to be removing your Foley catheter. So first I would go ahead and empty this before I remove it. So we have that emptied, and then we're going to go ahead and unattach it from the patient's leg. Get rid of that. Then we are going to get a syringe. We are going to hook that up, and then we are going to de-inflate the balloon, and we're going to let the patient know what we're doing. Alrighty. So that's good, and then we're going to let the patient know to take a deep breath, and we're going to remove it. So we're going to discard this per hospital protocol, and then we are going to help the patient with any peri-care that they might need. We're going to clean up all of our garbage, assist them to a comfortable position, and then place the bed in the lowest position with the